The second head measurement we should take is the head circumference. We measure at the same level as BPD. It is important to measure just outside the outer margin of the skull to be accurate. Do not include the skin. The entire skull should appear smooth and oval. We will demonstrate this during hands-on practice. As you do with BPD, always measure at the level of the thalamus and the CSP. Note that the ellipse is on the outer edge of the skull. Here is another example. Please pause the video now to ask a participant to point out the thalamus, CSP, and comment on the caliper placement for the BPD and head circumference ellipse. The following slides show the appearance of the head circumference at different gestational ages. This image is at 16 weeks. At this time, the structures are small and sometimes hard to see. This image is at 32 weeks. It also becomes hard to see the landmarks as the baby gets closer to the due date. Is this a good image to measure a head circumference? Why or why not? Please pause the video now to encourage responses from the group. The answer is no, because we cannot identify the thalamus or CSP. Is this a good image to measure head circumference? Why or why not? Please pause the video now to encourage responses from the group. The answer is no, the head is too small to see the landmarks well. The falx is continuous, and there is no thalamus. Is this a good image to measure the head circumference? Please pause the video now to discuss why or why not. The answer is that the image is too low to be accurate. The white structures shown by the arrows are bones at the base of the posterior skull. So this means we are too low to measure the head circumference or BPD. There should be no bright white structures in this area. You shouldn't see any bone. This is even lower than the cerebellum. The abdomen is the next structure to measure to determine gestational age. Please pause the video now to ask your trainer to show on a doll the level of the cross-section to image for estimating gestational age. Then identify the important landmarks in this image which you need to see to measure the abdominal circumference. We have outlined these structures here. They are the umbilical vein, stomach, and spine. Note the curved shape of the umbilical vein, which suggests that this is an excellent level for measuring the abdominal circumference. Can you determine the lie and presentation of the baby from this transverse scan? Please pause the video now to discuss within the group. The answer is that the baby is in a longitudinal lie with a cephalic presentation. The fetal spine is on the mother's left. To measure the circumference of the abdomen, we want to be at the level of the umbilical vein. A curved umbilical vein is the best level for measurement, but a straight vein is acceptable. Make sure that you also see the stomach and spine, and that you do not see the kidneys and bladder, which would make the measurement too low. The abdomen should appear round. The ellipse should be positioned at the outer edge of the skin. Please note that the umbilical vein is anechoic and appears black because it contains fluid. The stomach is also anechoic because it contains fluid. The spine appears hyperechoic or white because it is bone. Note how the whole abdomen appears round and the ellipse is on the outer edge of the skin. Please ask a participant to identify the umbilical vein, stomach, and spine. Answer the questions. Is the abdomen round? And is the ellipse position correct? Please pause the video now to discuss. The answer is yes, the ellipse position is correct. Structures have been labeled to make them more obvious. Please ask another volunteer to identify the umbilical vein, stomach, and spine. Pause the video now to discuss. The answer is that the umbilical vein is not visible here. The abdomen is not round and instead appears more oval. The ellipse is positioned correctly around the outer edge of the skin, but this is not an acceptable measurement because we cannot see the umbilical vein and the abdomen is not round. And we see an additional anechoic structure, the heart. Is this a good image? Notice how small this image is compared to the rest of the image. The object you are measuring should fill most of the screen. Readjust your depth and zoom to make this object fill the screen. Please ask another participant to identify the umbilical vein, stomach, and spine. Then please answer the questions. Is the ellipse position correct? And is the abdomen round? Please pause the video now to discuss. We have now labeled the structures, but what is this? The answer is that this is a kidney, which means that this is the wrong level to measure the abdominal circumference. The final task that we will discuss in this lesson is how to measure the femur length. Here you can see the femur, which is the bone in the thigh. To properly measure the femur, rotate the transducer until the femur becomes as long as possible. Please ask your trainer to demonstrate this with the doll. If you see two bones next to each other, or fingers or toes, then you are not at the femur. Here's an example of a femur length measurement. Remember that bone is white. Measure the bone only. Do not include the black at the ends. That is cartilage, not bone. If you see a point at one end of the femur marked as point A with an X, do not include it in your measurement. Measure instead from the end of the femur marked as point B with a plus sign. The measurement between the X's is incorrect. The measurement between the plus signs is correct. You can measure femur length in a young fetus starting at 13 weeks. The measurement in this top image corresponds to a gestational age of 16 weeks and 4 days. You can also measure fetuses close to term. In the bottom image, the femur length corresponds with the gestational age of 32 weeks and 2 days. It is usually easier to measure the femur that is closer to the transducer. Note that in the top image, both femurs are visible, but the femur closest to the transducer is easiest to see. Is this femur length measurement correct? The answer is yes. How could the image be improved? Please pause the video now to discuss in the group. The answer is that the image is too small. Adjust the depth to enlarge the image. What are we looking at in this image? Can we measure the femur length in this image? Please pause the video to discuss in the group. This is not the femur. It is a lower leg that contains two bones called the tibia and fibula and a foot. The structures are shown here to make them more obvious. Let's review the key points. Accurate measurements are essential to determine the correct gestational age. Accurate measurements require the correct anatomic level and correct caliper placement. If you can't see the head, abdomen, or femur anatomy well, do not take those measurements for fetal dating. Questions for review. What are the 4 key measurements you should take in the second and third trimesters? The biparietal diameter, the head circumference, abdominal circumference, and the femur length. How many times should you measure each structure in order to be accurate? The answer is 2 times. Where should you place the calipers when measuring the biparietal diameter? Outer edge of the skull to the inner edge. Which 3 structures should you see at the correct level to measure the abdominal circumference? Stomach, umbilical vein, and spine. Which structures in the fetal brain indicate the correct level to measure the biparietal diameter and head circumference? The CSP and thalamus. When measuring the femur length, where should you place the calipers? At each end of the bone, measuring mid-shaft. Thank you for your attention and interest in learning pregnancy ultrasound.